Nedocromil drops are used to relieve itchy eyes caused by allergies. They work by decreasing the release of natural substances in the body that trigger allergic reactions. It is important to use this medication as directed by your doctor for the best results. Typically, the recommended dosage is 1 to 2 drops in each affected eye 4 times a day. It is best to use the drops at regular intervals throughout the day for optimal relief. Before using Nedocromil drops, make sure to read the instructions provided by your pharmacist. Use this medication in each eye as directed by your doctor, usually twice daily, every 12 hours. It's important to use this medication regularly to get the most benefit from it. Try to use it at the same times each day to help you remember. Continue using this medication as prescribed until pollen season is over or you are no longer exposed to the allergic substance, even if your symptoms improve. Before applying the eye drops, make sure to wash your hands. Avoid touching the dropper tip to prevent contamination. If you wear contact lenses, ask your doctor if you can continue wearing them while using this medication. If your doctor gives you the green light, keep in mind that the preservative in the eye drops can be absorbed by your lenses. Remove your contact lenses before using the eye drops and wait at least 15 minutes after each dose before putting them back in. To apply the eye drops, tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Apply 1 drop into the lower eyelid and then gently close your eyes for 1 to 2 minutes. Use gentle pressure at the corner of your eye near the nose to prevent the medication from draining out. Do not blink or rub your eye. Repeat these steps for the other eye if your dose is more than 1 drop. After each use, replace the dropper cap and keep it tightly closed. If you are using other eye medication, make sure to wait at least 5 minutes before applying it. And always use eye drops before eye ointments. Lastly, if your condition persists or worsens, be sure to inform your doctor. If you experience burning, stinging, or irritation in your eyes, headache, stuffy or runny nose, a bad taste in your mouth, or increased sensitivity to light, these are common side effects of Nedocromil drops. If these effects persist or worsen, contact your doctor or pharmacist. Your doctor has prescribed this medication because they believe that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, if you notice swelling of the eye or have a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of potential side effects. If you experience any other effects not mentioned, contact your doctor or pharmacist. As always, consult your doctor for medical advice about any side effects. Before starting to use Nedocromil drops, make sure to inform your doctor or pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Before using this medication, also inform your doctor or pharmacist about your medical history, especially if you have any eye problems. After applying this medication, your vision may become temporarily blurred or unstable. It is advised not to drive, use machinery, or engage in activities that require clear vision until you can do so safely. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is not known if this drug passes into breast milk, so it's best to consult your doctor before breastfeeding. As for the daily dosage, it is recommended to use the medication as prescribed by your doctor or pharmacist. The optimal timing for taking Nedocromil drops may vary depending on your specific condition, so be sure to follow the instructions given by your healthcare provider. When using Nedocromil drops, it is important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Nedocromil drops. If this medication is swallowed, it can be harmful. In case of an overdose with serious symptoms like passing out or difficulty breathing, it is important to seek medical help immediately. For those in the U.S., you can contact your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control centre for assistance. Now let's talk about the uses of Nedocromil drops. These drops are commonly used to prevent and relieve symptoms of a certain type of eye allergy called allergic conjunctivitis. It works by preventing the release of substances in the body that cause inflammation. The usual dosage for adults and children is 1 to 2 drops in the affected eyes 4 times a day. It is important to use this medication as directed by your doctor. The best time to take Nedocromil drops is usually in the morning and evening, or as recommended by your healthcare provider. You should not give this medication to anyone else. If you happen to miss a dose of Nedocromil drops, take it as soon as you remember. However, if it's almost time for your next dose, it's best to just skip the missed one and continue with your regular dosing schedule. It's important not to take a double dose to make up for the missed one. Stick to the recommended dosage and timing for the best results. You should store Nedocromil drops at room temperature or in the refrigerator. Make sure to keep all medications away from children and pets. Do not flush the drops down the toilet or pour them into a drain unless instructed to do so. When the drops expire or are no longer needed, be sure to properly discard them. You can consult your pharmacist or local waste disposal company for guidance on how to dispose of the drops. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.